A normal oxygen saturation level is 70 to 80%, 85 to 90%, 95 to 100%, 60 to 75%. Correct answer is option C, 95 to 100%. Which type of isolation is required for a patient with an often worn infection? Contact precautions, droplet precautions, airborne precautions, reverse isolation. Correct answer is option A, contact precautions. Which test is used to monitor long-term blood sugar levels? Fasting glucose test, random blood sugar test, hemoglobin A1C test, insulin tolerance test. Correct answer is option C, hemoglobin A1C test. Which site is best for an intramuscular injection in an adult? Abdomen, vastus lateralis, gluteus maximus, deltoid. Correct answer is option D, deltoid. A patient with fluid overload may have dry skin, increased urine output, edema and shortness of breath, low blood pressure. Correct answer is option C, edema and shortness of breath. A patient on bed rest is at risk for which complication? Hypotension, deep vein thrombosis, hypertension, increased metabolism. Correct answer is option B, deep vein thrombosis. Which nutrient is most important for wound healing? Protein, carbohydrates, fats, sodium. Correct answer is option A, protein. The normal heart rate for a healthy adult is 40 to 60 beats per minute, 60 to 100 beats per minute, 100 to 120 beats per minute, 120 to 140 beats per minute. Correct answer is option B, 60 to 100 beats per minute. Which artery is commonly used to check the pulse in infants? Radial, femoral, carotid, brachial. Correct answer is option D, brachial. Which symptom is a classic sign of dehydration? Increased saliva production, sweating excessively, dark color urine, high blood pressure. Correct answer is option C, dark colored urine. A patient refuses treatment. What should the nurse do? Ignore the patient's wishes, report the refusal and document it, force the patient to comply, call security. Correct answer is option B, report the refusal and document it. A patient with a severe allergic reaction should receive which medication first? Antihistamines, epinephrine, steroids, oxygen therapy. Correct answer is option B, epinephrine. What should a nurse do before administering digoxin? Check apical pulse for 1 full minute, monitor respiratory rate, check blood pressure, none of the above. Correct answer is option A, check apical pulse for 1 full minute. A patient with a temperature of 102 Fahrenheit is at risk for hyperkalemia, dehydration, hypoxia, increased blood sugar. Correct answer is option B, dehydration. Which vital sign is most important in detecting early signs of shock? Temperature, pulse rate, blood pressure, respiratory rate. Correct answer is option D, respiratory rate. The best way to assess pain in a non-verbal patient is ask the family, use a faint scale, check facial expressions and body language, ignore unless the patient complains. Correct answer is option C, check facial expressions and body language. A patient with liver disease is at risk for slower drug metabolism and toxicity, faster drug metabolism, increased drug excretion, decreased drug absorption. Correct answer is option A, slower drug metabolism and toxicity. What is the primary purpose of medical asepsis? Kill all bacteria, reduce the spread of microorganisms, sterilize all equipment, keep the patient in isolation. Correct answer is option B, reduce the spread of microorganisms. The term nosocomial infection refers to an infection that is acquired in the community related to antibiotic resistance caused by bacteria only, hospital acquired. Correct answer is option D, hospital acquired. A patient's oxygen saturation suddenly drops to 88%. The first action should be call the doctor, check the patient's airway and reposition them, increase IV fluids, administer pain medication. Correct answer is option B, check the patient's airway and reposition them. A patient with a cough, fever and tuberculosis should be placed in contact precautions, droplet precautions, standard precautions, airborne precautions. Correct answer is option D, airborne precautions. When lifting a patient, the nurse should bend at the waist, keep feet close together, use leg muscles to lift, keep arms straight. Correct answer is option C, use leg muscles to lift. Which sign indicates hyperkalemia, high potassium levels? Muscle weakness and irregular heartbeat, increased urine output, low blood pressure, increased thirst. Correct answer is option A, muscle weakness and irregular heartbeat. A nurse is caring for a patient with diarrhea. The biggest concern is low blood pressure, electrolyte imbalance, weight loss, increased appetite. Correct answer is option B, electrolyte imbalance. Which action is essential before administering insulin? Check the patient's weight, monitor the patient's blood sugar level, give the patient a snack, assess blood pressure. Correct answer is option B, monitor the patient's blood sugar level. A patient complains of chest pain. What is the nurse's first priority? Administer pain medication, provide emotional support, call the doctor immediately, check vital signs and oxygen levels. Correct answer is option D, check vital signs and oxygen levels. The best way to break the chain of infection is to wear gloves at all times, maintain proper hand hygiene, avoid touching patients, stay away from sick people. Correct answer is option B, maintain proper hand hygiene. A nurse is caring for a patient in shock. What is the best position to improve circulation? Trendelenburg position, supine position, prone position, high Fowler's position. Correct answer is option A, Trendelenburg position, head down, legs up. Thanks for watching. Subscribe to the channel for the latest informative MCQs.